Hello, I'm Dr. Manjula. I'm an IVF specialist and director of Aansh IVF Hospital and Fertility Center, Koramangala, Banglore. Today I'll be telling you what infertility means. Any couple who are married and staying together for one whole year and been sincerely trying to conceive without the use of any modes of contraception will be able to conceive in this stipulated time. But 80% of the couple will conceive in first year and remaining 20% in the subsequent 6 months to 1 year. Suppose you are not able to conceive in the stipulated time, you are labeled as infertile couple or you have a problem with infertility. So you have to understand there's something hindering this process of conception. So you need to go to a nearby obstetrician or a gynecologist to do your basic investigations and to find out the cause. Before doing the basic investigation, you have to understand how a normal conception takes place. A female has internal reproductive organs which consists of a uterus where the baby grows for 9 months, both side fallopian tubes and both side ovaries. These ovaries are the organs which have eggs in it. How many eggs have to be there in this ovaries is predetermined before any baby girl's birth. So each girl is born with a fixed reserve of eggs. These are in a resting stage till she hits puberty. When she starts menstruating, every month few eggs are recruited and they start growing. The one which becomes the lead follicle is the dominant follicle for that particular month, and if she is menstruating properly, that egg matures and ruptures at the middle of the cycle, which we call as ovulation. The egg which is released during this process is grabbed by the fallopian tube, and that's how it reaches the fallopian tube. During the same time, if the couple have sexual intercourse, semen get deposited in vagina, the sperms which have good motility swim up on their own and reach the fallopian tube. Here the union of these two gametes takes place and the resulting product is called the embryo. This is the first step towards life, which stays in the fallopian tube for the initial 3 days and slowly migrates towards the uterus and reaches the uterine cavity by around 56th day. By then the innermost lining of the uterus, which is called as the endometrium or the embryo bed, is ready. In simple words, if you say the embryo is the seed, the uterine lining is the soil, this is where the embryo gets implanted and it starts growing for the next 9 months if there is no hindrance. So now you have understood both the partners are equally responsible for conception, and that's why both of them have to reach the gynecologist and both have to be investigated. What are the investigations to undergo? I'll be telling in my next video. Thank you.